Assalamu alaikum. Peace be upon you all. This is your host, Aminah Ahmed, and you're watching Muslim Network TV. Welcome back to another episode of Next Gen, where we speak to young people, young, passionate individuals, activists, and advocates all across the world who are addressing the issues that they face in their community. You're watching us today on Galaxy 19 Satellite, MuslimNetwork.tv, Amazon Fire TV, Roku, and Apple TV as well. Now, today's discussion here on NextGen is one that is truly long overdue. With the new strain in India as well, the COVID-19 crisis is one that all across the world people are hearing about. What is happening in India, the shortage of the oxygen beds, as well as mass cremations, are things that have made the headlines. Holy rivers are seeing dead bodies be dumped in masses, and those in India, especially those of the lower caste and lower class, are being affected disproportionately by this virus and by not being able to get oxygen and beds as well. So today we have with us a young individual, Vijay. He is from the state of Karnataka. He's in South India at the moment. He's passionate, full-time social worker and activist, and currently leads a youth movement in Karnataka called Yuva Shakti, which means the power of the youth. He is grounded in youth work, and apart from his full-time job, he has given his time as a board of director to a couple of United States-based organizations as well, Hindus for Human Rights. We've had a couple of representatives from that group on our show regarding India previously. He is also mentoring a young agribusiness startup because he works with farmers in India, and it is one of the worst farmer suicide hit rate areas in India. So we'll talk to Vijay about that. There is so much to talk to Vijay about today. I was reading his bio and I didn't know where to start, but he wants to be one of those on the headlines making changes in India. Thank you so much, Vijay, for being here with us today.
Thank you, Aminah, for having me. Thank you so much.
Now, Vijay, I want to hear from you, someone who is in South India right now, someone who you've told me that most of your work is based in rural India. You have been working closely with farmers. What is happening on the ground in India? I want to hear it from you as an Indian.
So the second wave, as they call it, of COVID has unfortunately penetrated into the rural parts of India, unlike the first wave. The first wave was restricted to metros, to the urban middle class, or even the urban upper caste to an extent. And rural India was almost insulated out of it because there was a huge, massive lockdown which happened and restrictions on travel. But because of lockdown, there's an indirect effect on the migrant laborers, migrant workers, because it was a national lockdown. But second wave, unfortunately, has penetrated into rural India, which means that our health system is exposed. It's not a very strong government health system that we have. We invest just 1.2% of our budget on health, 1.2%, which is amongst the lowest in the world, one of the lowest in the world. And this means that the public health system, the amount of doctors, the amount of facilities which are closer to the villages are absolutely less. At the same time, access to information, access to verified, valid information is absent from the villages. To give you a small context, vaccines, right? Vaccines are the only way out, as many scientists and many experts in the field are telling us. But in India, to get a vaccine today, you have to register on an online app. And imagine the digital divide in a 1.3 billion plus country. And people who don't have access to internet, who don't have access to how to type on a mobile phone, how will they register themselves? Forget about getting vaccinated. And who is going to talk to them about? There are so many myths about vaccines. They're scared. Like, people are scared, right? Anything new scares us. And COVID is something new. They haven't heard about this. People are scared of wearing mask in village because the stigma associated with the disease. People are also scared of getting tested in villages because people are scared that I'll be ostracized from my community. And so even if you have a symptom, you would rather stay within indoors and not get tested or take any precautionary or get access to medical support. But having said that, if you look at the death numbers, I think it's still more significantly skewed towards urban India. I don't know if it is a good thing or a bad thing, but if only we are able to address the vaccines on time to rural India, we will be able to save a major disaster.
Right, and we will continue talking about that stigma that is there in the rural parts of India. But right now, I want to hear, what do you think about the government's handling of the situation? I know that you, Vijay, being someone that has been working for the people, probably have a lot to say about that. I was actually reading that there were about 27 million reported cases, but then, the actual number that experts are saying right now is, I believe, 539 million reported cases. There's a huge gap between those two numbers. What do you think about the government's handling of the COVID situation?
I think it has been absolutely dismal. Like any government which will want to be there with the people and for the people, and if they had more than 9 months, in fact, I can say even 1 year, to prepare for this. Like you had time to set up oxygen plants. You knew a second wave is coming. Unfortunately, this is not a government which thrives on science and technology. You look at the ministers in the government talking about pseudosciences of how cow urine saves them from COVID. All these are aired on national television. Just last week, we had one of our spiritual so-called gurus coming, who has a industry on, who has a pharmaceutical Ayurved, not pharmaceutical, but FMCG industry, biggest industry, one of the right now in the country. He came on, he was live in a conference somewhere, and he ridiculed science and the Indian Medical Association. He blamed doctors for many of these deaths and their medicines for many of these deaths. So it was an attack on allopathy. And the highest medical body in India right now, Indian Medical Association, has been totally taken back seated, and they're calling this ridiculous. They're filing cases against this person who is a big shot favorite of the government. So you have one government which encourages mythology over history, which encourages or confuses mythology with history, which encourages pseudosciences and has least regard for sciences. The simplest thing that I think the government could have done is have an empaneled committee of experts, let them guide you. Instead, what happened was in December, in one of the ruling party meetings which happened, they publicly declared that India has won over COVID. And when this goes on air on live, people believe it. People were like, okay, we are over COVID. Even the prime minister was on record claiming to the world that India has victory over COVID and managed COVID. And then you had one of the biggest religious festivals preponed by a year, called the Kumbh Mela, in the most populous state in the country, Uttar Pradesh, and another state, Uttarakhand, where millions of devotees came and took bath in the river Ganga. So these are the super spreaders that were the reason for second wave to hit so big. And then you had elections announced in between the pandemic. And in West Bengal, because the ruling party was so desperate to win, they pushed the election commission, if I can say so, to actually phase one state election into 8 different phases. So you had one election going for a prolonged period of time, so that you get more time to do rallies. So technically, what was happening was the prime minister was in election campaigns, which were attended by thousands, if not more, making speeches calling, "I have not seen a bigger crowd than this," not wearing a mask. And in the evening, the prime minister comes on air and talks to the public, a one-way conversation, which he is known for,
Right.
and asks us to wear masks, maintain social distance. So this kind of double speak did not help the government. I just hope they had taken it more seriously. They had taken the warnings more seriously and prepared for what we were to see. I won't say they would have saved us from second wave, but they could have minimized the damage that's happening.
So in the middle of a crisis in India right now, right, the second most populous country in the world's largest democracy, we are seeing elected officials, right, the prime minister even holding rallies, attending religious festivals, instead, and then also going home and telling people to stay at home. I think that there's maybe a level of hypocrisy even that is existing from those in power in India. But you also spoke about those in the healthcare and how the doctors and such are demanding that they are given the credit that is due. What does the new COVID strain mean for India's healthcare system? What does it mean for the doctors that are already overwhelmed, that don't have resources? What does this strain mean for them?
Sadly, it's not good news, but I must give credit to the medical staff and people are like really very close, whom I know are working more than 24/7, if I can say so, leaving their families, staying in the hospitals, and there have been so many doctors who have died. And remember, we cannot replace doctors. If we lose doctors, it's a finite resource, right? We have X
Right.
number of doctors, and if 100 doctors die, for example, and I'm sorry to say this, but then it becomes X minus 100 doctors available, which means the population is the same, but the doctors you have is reduced. So it's been very tough for them to be on the ground, and the kind of misinformation about allopathy and kind of non-scientific statements being made against the scientific medical community is not helping them either. So I just wish I had ways to communicate what could have eased the medical staff's burden. But I think they're doing a remarkable job. They're doing their best. They're stretching it. But to be honest, the COVID second wave, the new strain has exposed the weak public infrastructure, public health system that we have to the fullest, and also the inaction in the last 10 months. There have been various suggestion recommendation by experts in the field that get medical students who are in their final year, give them small trainings and let them at least assist the doctors. Take the
Right.
nursing students, let them assist the doctors. And these suggestions are on for last 6 months or more, and nobody paid a heed to them. It's only last month that there was a very notional announcement being made that these kind of there are now incentives being given for final year students to be part of the COVID force and stuff like that. I just hope this had happened a few months before.
Right. I don't think that anyone would have lost anything from people listening to those who are educated in the science. And but in India, we seem to be seeing a different trend where many are gravitating towards anti-scientific facts that are being, put out by officials. So I don't even know if I blame the general public for what we are seeing in India right now. Vijay, we will continue our discussion right after our short break. You are all watching us on Galaxy 19 satellite, MuslimNetwork.tv, Amazon Fire TV, Roku, and Apple TV as well. We'll be right back after our break. Welcome back Next Gen. I'm here with a young, passionate social worker, Vijay. Thank you, Vijay, again for being here with us. Vijay was telling us about the ground situation in India right now. What do you think that the government can do better, right? This is not something that, we both are sitting here and looking at something that has happened in the past. This crisis is ongoing. More lives are being taken every single day. What do you think that the government can do right now to prevent these lives from being taken?
Just listen to people, which just listen to the experts, listen to the medical community, what do they have to say. And unfortunately, that's one thing this government is not used to. The prime minister has a one-way dialogue called man ki baat, so he's most
Yeah.
used to speaking and not listening. And a lesson for all of us, I think, this pandemic is giving humanity, the nature is like speaking to us, like, come on, rethink your lifestyle, what's happening. And we just need to listen to these voices. I hope the government listens to these people, because it's not, we have people who know what this is. We have epidemiologists who can tell us what a third wave is going to look like. There is enough science and research in the country and across the world. The world has in a way come together during COVID. There are other countries where you can take examples from how did they deal. You just need to have the heart and the mind to just listen and let go of your self pride for a minute. It's okay. You can say it's okay, we messed up, but we don't want to mess further. We just want to listen and take actions to prevent and save as many lives as possible.
Right. I know that after this, second wave hit, the prime minister took about 2 weeks to finally address the nation. And you say that, he does address the nation in his Man Ki Baat. I think that there's no room for dialogue. There's no room for people, the normal average Indian to give their input. But Vijay, how has this crisis, how has the second wave impacted those that are of lower caste disproportionately?
Uh, I think more than the COVID itself, I think what has impacted them are some actions that government takes in the times of COVID, like a lockdown, for example. Like, I'm not really sure if a lockdown can actually bring down the COVID numbers. I just hope it reduces the burden on the hospitals and stuff like that, what they claim. But what a lockdown does is expose the lower caste, lower class people who are daily wage earners, right? You have your daily shop closed, and what is your means of livelihood? Then are we ensuring that they get daily food access to food, dry ration, access to some income that keeps them going? And that's how the thing they are currently hit the most. But the cases, as the cases are increasing in rural India, I think there's a direct proportion into your social status in the society, which caste you come from, and your access to resources. Like, if you are highly likely to get access to a hospital in a a bed in a private hospital, if you have enough money and if you have enough contact to reach the private hospital, or even pay to the ambulance to reach there, which is not true for the backward castes and the most marginalized section of the country. We are not yet in a position to actually analyze and say this is the exact numbers which have been impacted, this is the exact number of deaths which have occurred in this. But the most important factor which has impacted them is economic, and it is going to have an impact on their further saving propensity, the way their kids will. There's a study which many studies which pointed out that many people who have dropped out of school during COVID might never return to schools, and it's been more than a year since most of the schools are shut. And even in private schools where schools are functioning, it's online. But then the question remains: how many Indian kids can afford to be online and participate
Right.
in a classroom? And is it the same for a government teacher? I cannot imagine them. I've seen governments, I've worked with them. I can't imagine them addressing 100 students who are first time using their phones. I know people, parents who sold their jewelry and sold their whatever little things they had to buy a smartphone
Wow.
during the first wave so that their kids can continue educating.
Right.
But then how are we going to bridge that gap, right? If a student is in a classroom, there are different ways to socialize, to ask questions. Online, it's going to be mostly one way. And yeah, local community schools are very, very far from reality as of now. Uh, yeah, I'm just lost for
Well,
words.
yeah, I think that just the fact that you said some parents have to sell the little, jewelry or whatever that they have to allow their kids to get an education. There is most definitely then a gap between people who come from a better or a higher socioeconomic status and children that don't. You also said that there are some children that may never go back into getting an education, and I think the illiteracy rate in India, it speaks for itself. There isn't even much to be said in that. But you have been working, Vijay, with farmers, and farmers actually have been a target, have been scapegoated in many ways, saying that they are the cause of an increase in cases. How do you feel about that as someone that has been on the ground, that has seen these protests firsthand?
This has been a standard response of this establishment. In fact, when you had the CAA protests happening, it was the COVID first wave which actually disrupted the CAA protest. And then they were blaming they gave petitions in court, if I'm not wrong, telling that this is a threat for public safety. These Muslim women are threat for public safety.
Right.
So if you are a Muslim woman protesting, you become a pro-Pakistani. If you are a farmer protesting, and since many of these farmers are from a state called Punjab, which
Right.
happens to be the biggest beneficiary of the agricultural revolution, the green revolution, and these are the most well-off farmers in the country. And if they see a problem in a law, and they come out to protest, you call them anti-national forces and call them pro-Khalistani people. And it's been very, very sad that an establishment has to use these tactics rather than just sit with them and listen. What are your demands? Okay, can we figure it out? Why did you have to pass an act without consultation in the first place? I'll tell you what's happening today in these protest sites. People are giving out the langars, which were distributing free food, are today distributing free medicines and oxygen supply. So they
Wow.
are trying to help the crowd of Delhi and the help the crowd of people around them. They're setting up free health camps. They're setting up. The doctors are there in their vicinity, and they're taking all necessary precautions to ensure that if they have any symptoms within their community which is protesting, they are addressed, and they have sent a significant amount of protesters back home also, and try to decentralize the protest. So it's completely baseless to put allegations on the farmers who are protesting. In fact, just yesterday, the seventh anniversary of this government, first 5 years, and then this is second year anniversary, was celebrated or protested as a black day by the farmers across the country. Uh, and that was their way of telling that you don't care about us, and they're going to make sure that we will. It's of the people, by the people, for the people. On paper, we are still a democracy. So when the next election comes, I think farmers are waiting to give back an answer.
For sure. And I think politics is always a way that, being politically involved, being involved in a way where you can make a change, right? We've seen the farmers on the ground. They've been doing the groundwork, and now even politically, they want to make that influence. That is absolutely phenomenal. But I want to talk about not just in India, we're seeing these huge protests, but outside of India, what can people do to help, right? What can people do to help those who are affected, who don't have oxygen, who don't have beds in India? And I don't live in India, and many of our viewers don't. What can they do to aid?
I think there are a lot of crowdfunding platforms. In fact, there's already a lot happening from across the world, from the Gulf, from the US, from the UK, every part of the world where relief is coming in. Unfortunately, the financial regulation acts and all these things are one big difference between the first wave and second wave is also the curb on getting these small NGOs in India foreign funds. So the NGOs in India don't have any more funds to work or be there on the ground. But there are a lot of individuals who are doing crowdfunding, trying to source oxygen supply. And please, whatever you come across, verify whether it's the credible source, and try to do what little you can. But apart from financial aid and supporting directly, try to highlight what's happening in India. I think the world deserves to know what's happening in India. The more you talk about it, the more the government is pressurized. One thing this government does care about is its own image. So we need the support of the international community for them to take effective actions. The international scientific community needs to push the government, ask them, and force them to listen to scientific community within the country and across the world. Organizations like the UN, WHO needs to be forced to issue public statements of how can a government be numb to anti-scientific claims by their supporters or ministers or whoever, and try to be factual, try to be scientific. We need the international community's help to spread these kind of information, and just ask the government to listen to its own scientific community. That's all. I think that should be enough. And I want to thank also the international community for reaching out. The pandemic also has kind of brought all of us together, and that's something that's really what we believe in India, that the world is one. Hinduism also talks about Vasudhaiva Kutumbakam. We all are a family, and I'm able to feel that from the fact that you thought that this topic is important and reached out to me to represent youth in the country. I think thank you for that, and just keep continuing doing it.
Thank you so much, Vijay. To our audience, I plead with you to support organizations. Obviously, make sure they are credible, that are providing relief in India. I know that there are many in the United States, and we can provide links, in the description box. Thank you so much, Vijay, for being here with us today. It was an absolute pleasure speaking with you.
Thank you. Thank you for having
And to
me.
our and to our audience, thank you so much for tuning in. We'll be back next week with a new episode of Next Gen, speaking about what is happening in Palestine right now and the occupation there. But for today, we are done today. Assalamu alaikum. Peace be upon you all. Thank you very much.